Okay, so my name is Kapil and I'll be talking about my Grace Cancer Foundation experiences and how this internship has helped me progress and learn much more about cancer than what I did when I started. So, just a small introduction about myself. I go to Arizona College Prep High School and I'm an incoming junior. For those who don't know what junior is, it's basically inter first year here in India. And I'm very interested in data science and cybersecurity, so I really found this project to be very interesting, especially on the data science side. Being in the guinea pig group, there were some hardships that we faced, but coming through an internship, that's something I expected, and the benefits definitely outweighed all the hardships that we faced. The motivation for me to joining this program is I have a driving interest for data science and community service. I volunteer at my local temple, which is where I met dear and uncle. I volunteer at many other places such as Feed My Starving Children and have gained a vast interest in data science. I understood that data science is heavily used in cancer screenings and data analysis, and that's exactly why I joined this program, and I have changed my perspective about cancer drastically. I wanted to perform lots of research after coming here and provide analytics that are helpful for the community to provide more effective cancer awareness. So, my initial learnings are that I was able to learn a lot about the Grace Cancer background and understand how exactly and why they performed lots of these cancer screenings, which impacted over 12 million lives in over 130 countries. So, some background information about Grace is it stands for Global Research in Cancer Education. The 3 C's are cure, care, and compassion with commitment. Reaching the unreachable is the motto. And they won 5 Guinness World Records and 1 Vindhya book of research. This project has been inaugurated in 2013, but I've heard that the idea of having Grace Cancer Foundation started from 2011. They also got a Guinness World Records for having the largest breast cancer screening campaign in the world. The 4 pillars are education, early detection, treatment and rehabilitation. And research. Some other stuff I learned from just being in the class is breast cancer and cervical cancer, which are mainly the 2 topics that we focused on. So I'll be discussing the causes, symptoms, and how to prevent these kinds of cancers. So some causes for breast cancer are extensive alcohol use, minimal exercise, exposure to harmful radiation, and smoking and chewing tobacco. Some symptoms are breast lumps, skin color starts to change, and nipple discharge. And obviously there are many ways to prevent it. However, the main one is to do education on self-breast examination and just to avoid all of these bad habits. Now to move on to cervical cancer, some of the causes are HPV infections, which is mainly how most of these cases are made. And then improper hygiene, which is something many of us know, and that's due to mostly lack of education. And then some symptoms are pelvic pain and watery discharge. So to prevent it, obviously as mentioned before, there's a lack of education. So if we're able to provide education on proper hygiene, it will definitely reduce the amount of cases. In addition to this, if you receive the HPV vaccine, it has shown that it definitely 100% minimizes your chances of getting cervical cancer, which is definitely something people should get through. And we should also help financially aid families that aren't able to afford it. And then yesterday when we talked to Dr. Chinna, he told us about the 4-4-80 rule. 4 bad habits lead to 4 incommunicable diseases, which leads to 80% of deaths. So the 4 bad habits are usage of tobacco, drinking alcohol, sedentary lifestyle, and unhealthy eating, which can lead to the 4 incommunicable diseases, which are cancer, diabetes, cardiovascular disease, and lung disease. And these 4 diseases account for 80% of the deaths in India. So basically what I'm saying is 80% of these deaths can be avoided by just having a healthy lifestyle. That's the main story here. So we visited the palliative care a few days ago, and palliative care is where terminally ill patients receive pain-suppressing treatment. And then there's also another side of this, which is hospice care, which when treatment is no longer effective, that's just where they're put. They still receive these pain-suppression treatments just to have a nice end to life. And then looking and learning about the various aspects of palliative care helped me understand how people live even at their last stages of life, and how this palliative care center tries to make the best of the last days of someone's life. And a very important concept that I learned was communication, because that is key when talking to patients and their families, to show that you really care about their situation and want to help them. Showing sympathy, empathy, and compassion when communicating to these people is crucial to comfort patients and bring potential unfortunate events. One of my favorite experiences on this trip was the Pony Jedla camp, which I had the opportunity to log over 50 registrations out of the 188 taken. There were over 46 mammograms, 14 x-rays, and 39 pap smears. I was able to look at all these machines after everything was done. I looked at the x-ray, the cassette recorder, the mammograms, and the pap smear room was in use, so we couldn't look inside. But I was able to understand the importance of various screening techniques such as mammograms, pap smears, and x-rays, and how they are able to early diagnose cancer. I was able to communicate with the locals, as you can see here, all these schoolboys. So that was really nice, and I was able to understand the importance of going back to my roots, where my parents, grandparents, and my whole heritage came from. Indoor Cancer Hospital. This was also something amazing. Hospital with free treatment run by dedicated staff to support cancer in rural areas. This is such an amazing feat, because lots of people in rural areas are not able to afford cancer treatment, and there are lots of cancer cases there. And having a hospital that gives affordable and free treatment is definitely something that was very helpful. I understood the importance of radiation, medical of surgical oncology, and therapy. We visited 2 of the operation theaters. There were 10 ICU beds, and we attended a conference that was conducted by the hospital. We visited many of the treatment rooms and understood the necessity for the hospital in these rural areas, as over 5 different districts depend on that one area for cancer treatment. We examined the drug mixing, which is used for testing new cancer treatments on the patients. So some of my learnings at Indore, which is taught by Dr. Kiran Awancha here, Philip C. Wall and Mansukh C. Wani, they isolated two cancer-fighting drugs, Taxol and camptothecin compound. They drastically changed cancer treatment because they saw that llamas eating parts of the Brazilian yew tree didn't get cancer, which fueled their research. Now, in many drugs in medical oncology, Taxol and camptothecin are very common drugs used because they are able to combat cancer cells, which can definitely help. More learnings which I got were immunotherapy, which is still a rising field in medical oncology, which was founded by Jim Allison, which focused on creating new drugs to enhance the immune system to fight the cancer cells. Although you might think that this immunotherapy might affect skin cells, normal body white blood cells, it will not, because this immunotherapy is specially designed just so that it fights the cancer cells and not your normal body cells. Lots of research is being done on immunotherapy to treat all kinds of cancer, not just the specific types which are used today. Another form of cancer, multiple myeloma, also known as Kohler's disease, has a drug known mortezimib, which is also a drug that uses the Taxol and camptothecin to treat the cancer. Indore Tirumala, which is an amazing place. We went to this place after we looked around the Indore Cancer Hospital. This place was amazing because we were able to go into the farm, the 20 acres of land. We were able to go to the temple, eat like freshly made food. We analyzed lots of plants, which he said were able to cure various kinds of cancer, such as oral and cervical cancer. And this is all done through their organic farming through generations of practice. So I was able to understand the various medicinal herbs used to treat many diseases, not just cancer. As you can see here, we performed lots of mud farming and started planting rice and harvesting it. And this is through the 5-plant cycle which they use. All the food that is made in the temple is all grown on this 20 acres of land. And what they really focus on is to live with a healthy lifestyle so you don't get all these diseases. Next, we visited Yashoda hospitals to Dr. Chinnababu. So first we visited first we went through the surgery, which I'll be talking on the next slide. But after, we visited various of the medical departments such as radiation oncology, medical oncology, and then we looked at cardiology and many other departments. We understood the importance of targeted radiation to kill cancer cells at a specific point and analyzed pathological findings of the extracted uterus that we witnessed in the cardiology department. So some other places we visited were the gamma rays. We looked at the live hysterectomy, looked at a 200 crore radiation machine, which is one of a kind in all of India. We visited PET CT scanning rooms and we witnessed a laparoscopy and spine surgery as we were exiting. So this is a comparison between the Yashoda and Indore hospitals without the robots. So Indore Cancer Hospital, it has free cost treatment. It's funded directly by various donors. It specifically targets the lower income households in rural areas, and it partnered with many companies to create 10 ICUs and 2 operation theaters. On the other hand, Yashoda Hospital has very expensive equipment and buildings. It has paid treatment in an urban area, specifically, as Tejas mentioned before. It's for people that just sit down and do their work on a laptop. So they're extremely qualified doctors, extremely qualified. They have 10 plus operation theaters, 2 per department, so over 10 I know, but I don't know the maximum. They're capable of performing robotic surgeries anywhere they want, and they have doctors who are able to do it. Some similarities is they both have a facility for chemotherapy. They have a very well designed radiation therapy relative to their area, and they have a great reputation. So this is something very important. So this was the robotic surgery that we were able to witness under the guidance of Dr. Chinnababu. We were able to witness the extraction of a cancerous uterus through robotic surgery. So Tejas showed the arms in his picture. This is the machine that you sit, and then these are the arms that you can move by yourself, and it will move it on the robot. So some benefits of this type of robotic surgery is there's less recovery time, less blood loss, lower rate for infection, and it's much more zoomed in so you can see exactly what you want to see. The only limitation is that this equipment is very expensive to put, which is why you don't see it in your everyday hospital. So my future plans, I came here with an interest in data science and cybersecurity, as I wanted to focus more on the technological side. However, after attending this camp, I am planning to obtain a PhD in cancer research and biology to further my current research in cancer. I wanted to conduct more data analysis on cancer research being done in India and apply it into the US. I want to work with GCF team to make a publication about cancers, chewing and smoking tobacco and the influences it has on cancer and their consequences. In addition, I want to establish a GCF club at my school with my friends here to increase cancer awareness in my community, which can help me organize the GCF run through talking with them. Thanks.